Are you experiencing pain in the lower neck? Maybe it even sends tingling sensation into your arm or shoulder. You may be experiencing a condition called Thoracic Outlet Syndrome, or often abbreviated as TOS. TOS is the compression of typically one of three structures in this region on your body, and that being the veins, the arteries, or the nerves. Now, 95% of TOS cases involve compression of the nerves as they come out of the cervical spine here and extend into the shoulder, helping innervate all the way down to your fingers. With TOS, there can be a variety of different causes that are creating this issue for you. Here at Health-Fit Chiropractic and Sports Recovery, we're going to do a thorough examination and history to make sure we have the best idea on identifying the cause and then treating the cause going forward to help alleviate that pain, that tingling, or those symptoms you're experiencing. After we've conducted a thorough history and examination, we'll perform what's called orthopedic tests. Orthopedic testing, again, helps us confirm, rule in, or rule out specific diagnoses that we believe could be causing this pain to begin with. If we've confirmed that you, in fact, are dealing with thoracic outlet syndrome, we'll then begin treatment right away on that first visit to help alleviate any pain immediately. Treatment of thoracic outlet syndrome, or TOS, at HealthFit here can involve a variety of different treatment options. First, we'll want to make sure that we don't have any joint restrictions in the area. That can be restricted joint motion in the cervical spine, the mid-back or the thoracic spine, the ribs, the shoulder, and even the first rib tucked just behind the collarbone here. What we do is make sure that the joints are moving properly, and if they aren't, we'll talk about adjustments to that area where we provide a high velocity, low amplitude thrust very quickly, very light to that area to help restore proper joint motion. Once we've assessed the joints and cleared that of any restrictions, we'll talk about soft tissue restrictions in the area as well. There's a lot of different muscles that help support the head, that help support mid-back, the neck, shoulder, even into the chest here, that can all compress down on the nerves coming out of that region. So we need to assess the muscles in that area and relieve any of the muscle tension, such as trigger points or muscle knots in that area. And we'll do that through a technique called active release technique, or ART. Once we've assessed and made sure that the muscles are no longer restricting that area and the joint motion is proper in that area, we'll then talk about a few different options, such as one-on-one rehab exercise that you'll do in office here, as well as some exercise you'll do outside of the office at home. You'll work with either one of our clinicians here or with one of our rehab specialists to begin exercises in office, and then you'll receive a printout from us to keep up on exercises that you'll do in your own time at home, at work, at the gym, or wherever works best for you. Sometimes with thoracic outlet syndrome, we'll also incorporate some of our therapeutic modalities in the office here. Here in the office, we have two main modalities that we use, that being Class 4 cold laser, which uses specific light frequencies to help increase cell metabolism and cell turnover, essentially making sure the healthiest, newest cells in the area are present to help heal, and also incorporating extracorporeal shockwave therapy. Sometimes this is just called shockwave therapy. Shockwave therapy uses acoustic sound waves to help decrease pain and inflammation in the area, improve blood flow to this area, and then also recruit stem cells from nearby bone marrow to help repair any damaged tissues or tendons that may be present. If you have questions about how we can help you get rid of your thoracic outlet syndrome, feel free to stay tuned for more videos coming in the future, or give us a call today and we'd be happy to chat. Take care.